So when your head hurts, everything's an issue because you've got the sensitivity to light, to movement, even noise bothers a little bit.
It's difficult to live that way, yet finding relief can seem impossible. Our next guest often meets people in that position.
Dr. Angie Rakes is board certified in pain medicine with a specialty certification in headache medicine.
It's nice to have you here.
Yeah,
Thank you.
Good morning.
So some sufferers might not realize that a headache pain specialist even exists. I guess, what do you do?
You're correct. But patients that suffer from headaches are rather computer savvy, word of mouth. They get in the door. There's all sorts of migraines. There's tension headache, which is rather frequent, but they can take something over the counter, so they tend not to come and see me. But your migrainer suffers. Their headaches are disabling. The lights, as you mentioned, bother them, sound, even movement can bother you. You go to work, but you're not functional. The studies show us you're not functional. Those are the people that we can help. There is treatment for them.
Well, you get migraines a little bit, don't you?
Yeah, I've had them since I was 17 years old, so I know exactly what you're saying, and they can be horrible. I mean, you got to check out of life. They say, well, you want to go out to eat tonight? Can't. You want to go to see your niece or nephew? Don't feel like it. You know, and you hate saying that to friends and family.
True.
Even within migraines, are there types? You know, you hear like cluster headaches or any of that stuff?
There's different types, but again, the most common is migraine. One in every 4 households, there'll be a migrainer.
Wow.
28 million Americans, more common in the female population, 3 to 1.
Yeah, so what can you do? Well, how do your patients benefit from what you know about the treatment options there?
And my mom has them too. Can they be
Family
hereditary?
history. One parent, 40% chance of being a migrainer.
Really?
2 parents, 70%. Well, as you mentioned earlier, I am an anesthesiologist, certified in pain and headache, and that gives me the knowledge, the tools, or the ability to help with medication or sometimes injection, whatever's necessary to decrease your headache. We can't cure you. Headaches are a disease process like asthma or diabetes, but we can lessen how often you get the headache, how severe it is, and how long, because sometimes they can last up to 3 days.
No kidding. So you mentioned injections. I'm not familiar with that.
Well, medication is your first line of treatment most often. Sometimes an injection is indicated, such as an occipital block, a type of block on the back of the head. But there are those migrainers that have what we call chronic migraines, 15 or more headaches a month. Can you imagine that?
Oh, gosh.
Half your month or more.
Right. I've never even had a migraine, but I've had occasional headaches. How do you know if it's beyond taking maybe aspirin?
Yeah, to where you need the injections.
So you need that stuff.
Well, if you have a tension headache and you take something over the counter and it dissipates, and you're doing it once a week or once every other week, that's fine. But a lot of migrainers, the ibuprofen just doesn't cut it for them, and they're taking it over and over again. And the problem with that is if you take that medicine too often, you actually change the chemistry of the headache and you feed the headache. You have a daily headache. And then getting back, some people have headaches so often that the preventative medicines don't work. And then we have things such as Botox injections that are very helpful.
I started reading about that just more in science journals some years back before it was mainstream. Why is it that Botox can be effective with migraines?
You know, we don't exactly know how it works, but the studies are out there and we know who to use it in. And it's people that have chronic migraines, more than 15 or more headaches a month. And it's really changed people's life. It doesn't get rid of all their headaches, about 30 to 50%. And what's left is softer, so I can give you something to take to get rid of that headache.
Wow, wow.
Huge difference in your life.
How do you know if you're at that point in your life, if maybe you haven't had them for years and years yet, maybe you're still kind of new to migraines, how do you know if it's time to see you, or if you think you can cut it on your own?
Well, if something over the counter gets rid of your headache, that's one thing, but usually with migraines and other type of headaches, you can't get rid of it. You need help. You're suffering, you're debilitated by it. You might even be throwing up.
And in some cases, we need our family doctor to send us to you. Is that always the case, or can our viewers, if they feel like they want to get help, but they don't want to go through that physician first, can they call you directly?
They're always welcome just to come in directly, of course.
Great.
How about the injections? How often, if you need the injections?
For the Botox injections, it's a set of injections, and it's used every 3 months initially. And after 2-3 sets of injections, sometimes it can last a little bit longer. Then I ask the patient. They kind of guide me as to when they need them again.
And if it helps, if it works after 3 months, and if you're not, are the headaches gone permanently? The migraines gone permanently?
Migraines are never permanently gone. It's a disease process. So the Botox can last up to 3 months. Sometimes it can go longer for people.
This might be a silly question. I've never asked it, so why not do it on my
Right,
TV?
just do it.
Just do it. Are you injecting in the same place people would inject to get rid of wrinkles, or are you putting the
Some of
Botox
them
someplace
are.
else?
That's a very common question that females
I've always
ask.
felt silly, like, do you go, yeah, because you know
a
some
portion
women
of
do
them
it.
are in here, and they do soften the wrinkles. You're
Okay.
correct.
Listen, some side
It works.
effects are
That's a
pretty
good
nice,
question.
aren't they? So the website is unmcphysicians.com, and that's where you can learn more about Dr. Rakes and her practice. Where are you? Are you at Village Pointe?
Village Pointe, and also located in Bellevue.
You're welcome to call 596-4200, and as she explained, you don't need your family doctor to refer you on. You can make this call directly. UNMC Physicians also active on Twitter and Facebook, but if this is sort of an introduction to the center, the website might be a good place to get started. Thank you for coming in and talking to us.
Thanks
It's nice
again.
to see you.
Thank you.
It's nice to see you.